Hello, am I audible? Good evening, my respected judges. Today's my presentation on the case series of surgical management of 7 patients with different types of gastrointestinal stromal tumors. Next slide, please. Gastrointestinal stromal tumor is the most common mesenchymal tumors that originated from the GI tract. It originates from the intestinal cells of Kajals. Common sites most commonly in the stomach, 60 to 70%, then followed by small intestine, colon, and esophagus. All of the cases are diagnosed by CT imaging and immunohistochemistry CD117 and DOJ1. We evaluated clinical based on the clinical presentation, imaging followed by surgery and histopathological examination. Next slide, please. So here we can see the first case of gastric cyst. A 65-year male patient presented with the epigastric pain. On CACT it shows 25 by 12 centimeter exophytic gastric mass. Open distal gastrectomy performed, and on histopathology it is low risk cyst. On case number 2, it is the jejunal cyst. 58-year female presented with the anemia with local GI bleeding, 3.5 by 2 centimeter mass, segmental resection done, and on histopathology it showed intermediate risk. In the case number 3, that is the ileal cyst, the patient presented with acute abdomen in the emergency. Previously, patient has a CECT whole abdomen, and on CECT it shows 12 by 10 centimeter mass, ileal resection done. On histopathology it shows high risk. Next slide, please. Hello. Here you can see the colonic mass, that is cecal mass. 70-year male patient presented with the 15 by 8 centimeter mass, and in the case 5 it is the another colonic cyst. The mass originating from the descending colon. It is the 46-year male patient presented with abdominal lump with 25 by 15 centimeter on CECT. Right and left hemicolectomy performed, and on histopathology it shows height and moderate risk. On the case 6, it is the mesenteric cyst. Patient 64-year male patient with the mesenteric mass 6 by 4 centimeter mass, and on the case 7, it is the omental cyst. It is 65-year female patient with 15 by 10 centimeter masses. Segmental resection in the first case and omental excision on the second case. On histopathology it shows high and intermediate risk. Next slide, please. Next slide, please. So cysts is vary in their presentation and aggressiveness depending on the size and site. CT is the diagnostic of choice for the crucial diagnosis, staging, and surgical planning. Surgery always remains the curative for the localized disease. Laparoscopy for less than 5 centimeter lesion. Thank you.